And now, I am honored to introduce CRAN's President and CEO, Filomena Servidio-Italiano, who will provide the President's welcome and highlight a patient story. Anyone who has had the pleasure of meeting Filomena, whether online or in person, knows that she exudes an unmatched and unapologetic passion for improving cancer patient outcomes. Cancer patients and their loved ones are always at the center of Filomena's leadership. She has compassionately touched the lives of so many individuals impacted by cancer at a direct and personal level, and she also drives change at the system level in parallel. Filomena, our team here at CRAN, and so many patients and stakeholders across the country are so incredibly grateful for your leadership. I will hand it over to you to welcome our attendees today.
Thanks very much, Cassandra. I'm so grateful for your introduction. I look forward to your introductions every year. Thank you. Well, good morning, ladies and gentlemen, and a very warm welcome to our 4th annual Biomarkers Conference, focusing on the establishment of a national strategy for advancing comprehensive genomic profiling, or CGP, in metastatic cancer care as we align patient, clinical, and policy perspectives. I will share that my message to you this year is quite urgent in nature, based on the findings of our first phase of the CGP project generated just a few months back. Yes, I will repeat, urgent. Why? CGP is revolutionizing Canadian cancer care by shifting treatment from a one-size-fits-all approach to a rather personalized management of a patient's cancer through precision oncology. By analyzing hundreds of genes simultaneously from a single tissue sample or through liquid biopsy, our valued pathologists in the care continuum are able to provide our clinicians and their patients the exact genomic drivers fueling the growth and spread of the patient's cancer that can help to inform clinical decisions to not only help extend life, but improve quality of life as well. It's about gaining a better understanding of the tumor's biology in order to fully deploy the power of precision oncology. Based on the evidence generated in the past year, we are well acquainted with the benefits CGP may offer to Canada's healthcare system and patients facing metastatic cancers, not the least of which include a personalized approach to treatment, improved clinical trial access, improved patient outcomes by way of survival and quality of life, cost savings, and economic value. But despite these clinical and economic benefits, access to universal CGP remains fragmented across Canada and largely depends on provincial funding, private payer options, or as an out-of-pocket expense for our patients. So while we recognize there is much work to be done in Canada with respect to labs navigating several technical, clinical, and regulatory factors to facilitate CGP introduction, we at CRAN, along with our patient group partners, passionately and urgently advocate for equitable, nationwide access to CGP as a standard of care because metastatic cancer patients deserve nothing less, and we are prepared to do the work. To that end, I would like to introduce today's featured patient, Eric Hamilton, a young father, husband, patient advocate, and yes, a metastatic colorectal cancer patient who was diagnosed with the disease back in June of 2022. While at times heart-wrenching, I can assure you, my friends, his story is beyond inspiring and serves to remind us that the disease does not define a patient. Rather, the patient is defined by how we respond to the set of circumstances cast upon us during an exceptionally challenging, if not the most challenging time in our lives. And Eric epitomizes grace and courage during what I would call an unbearable time in life. His original diagnosis was stage 3 left-sided colon cancer, which was successfully treated, but he suffered a recurrence in his liver, for which he received surgical resection, but he once again recurred and could not resolve those pesky retroperitoneal lymph nodes. He accessed genomic profiling in Calgary, which did not reveal any actionable mutations, but did confirm the RAS wild-type status, which qualified him for the targeted therapy panitumumab in combination with chemo. This treatment protocol has been quite effective for Eric over the years, but Eric wants to be able to permanently resolve his cancer, much like any other stage 4 patient. He did access a more comprehensive genomic profiling panel, which essentially confirmed the findings of the first, but more importantly, it confirmed that his cancer's RAS status was still wild type and targetable with the panitumumab, ultimately providing Eric with great comfort. This, ladies and gentlemen, is yet another benefit provided by CGP to clinicians and patients. In the absence of an actionable mutation being identified, the findings can confirm an already identified biomarker status or can confirm a treatment protocol, which can in turn provide the patient and their family with much reassurance, comfort, and confidence with an established treatment plan. Good morning, Eric, and welcome.
Good morning, Filomena.
Good morning. We are delighted to have you join us today. This has certainly been a difficult and whirlwind experience for both you and your family, Eric, and we applaud your resilience, your fortitude, and how you've been such a champion, Eric, not only for yourself, but for others whose voice has been silenced or non-existent. So if it's okay with you, Eric, I'd love to ask you a few questions.
Let's do it.
All right. So one, you, my friend, are a young, early onset cancer patient undergoing a metastatic cancer journey. Can you share with us how that cancer journey has evolved for you since receiving that diagnosis in 2022?
Sure. Well, thank you. You covered some of it during the introduction, so I'll try to fill in a little bit for the audience. Like you mentioned, I was diagnosed at stage 3, and that was in 2022. I had a surgery. I had the adjuvant chemotherapy, and then I had a clear scan following that in December of that year. So I thought that this is great news. Maybe I'll have a chance to leave cancer behind. So life was good again. We went to Disneyland that year, and I was back at work. And unfortunately, I was, being still on surveillance. The CT scan in December of 2023 caught a recurrence in my liver and lymph nodes. So, in terms of the emotional impact, that was very difficult. Probably worse than the initial diagnosis because I knew that I was a metastatic patient at that time, and it was going to be very challenging. So I underwent that surgery, and the surgery on my liver was difficult, and the recovery was more difficult than the first surgery. And then I had to once I learned that the disease persisted, having to go back on chemotherapy and get a port and everything, that was very difficult as well. So then around that time, I heard people saying you have to treat it like a chronic disease. And I wasn't ready to hear that at that time. I didn't like hearing that it was a chronic disease, but I came to understand why people say that like it's a good thing, because a chronic disease is not the same thing as a terminal disease. It's something you can manage in the long term. So that's kind of how the so-called journey has evolved for me. I recognize I have a chronic disease that I'm managing, but I'm trying to make the most of life as at the same time.
Thank you. And in your own words, Eric, how did CGP help to inform the management of your metastatic disease?
Well, it yielded some insights that I think were valuable, and you covered some of the details. But the first test, I should point out that in Alberta, where I live, you do get a sort of a basic summary of the major mutations when you're diagnosed. So after my stage 3 diagnosis, actually, I knew that I was a RAS wild type because I was tested for some of those major mutations. But then I did the first test, and that was my oncologist's idea, and I thought he was really on his game when he recommended that, and he really wanted to know the HER2 status, and I think the other one he mentioned at the time was NTRK. So I was negative for both of those. But it did confirm that I was wild type, and that it was likely that panitumumab, which he recommended I take, was going to work well, and it did. And then the second type of test I did was about a year later, after I took a treatment break. Um, I did a liquid biopsy test. And it's good that those are available, because I don't think my tumors were available for biopsy. So did the liquid biopsy test. It still showed that the RAS mutation status was very low. So it confirmed that my current treatment would continue to work, which it did. And so I would have to say, did I get the needle in the haystack that cured my cancer? No, but it was helpful, and it will continue to be helpful for me.
Thank you. And finally, Eric, if you could make a recommendation to public policy experts regarding CGP, what would that recommendation be? I know you've done some work with the Canadian Drug Agency, who oversees drug funding recommendations. You can certainly speak to that. And I think there's a part B to that question, and that would be if you could share some advice with newly diagnosed metastatic cancer patients, what would that advice be?
Well, the recommendation part is I would just love to see it more accessible to any Canadian diagnosed with metastatic cancer, regardless of their means, because I'm a person who had the means to undergo the first test, and then I had the advice of a medical consultant on the second test, the liquid biopsy. So the fact that I was able to access those resources tells me that not every Canadian would necessarily be able to do that. And the as far as targeting, a message for the patients, I would say that make use of this resource, absolutely, if you can. And this is the future of cancer care. You want every insight and every option that would be available to you. So please don't miss out on doing NGS testing.
All right. Thanks very much, Eric. We're truly grateful to have shared this time with you today. I believe I speak for everyone when I say we wish you the very best in your cancer treatments. Godspeed.
Thank you so much.
Thank you. Thank you. Ladies and gentlemen, we are delighted to be hosting you today to help move the needle forward on laying the foundation for the establishment of a national strategy for CGP readiness. We have an absolutely stellar lineup of speakers whom we have secured to help us achieve our outcomes. And for the very first time this year, we are proudly offering simultaneous translation through captioning of the content in over 60 different languages to our audience to ensure optimal engagement and understanding. Thank you. Thank you for joining us today. You are all our raison d'etre. So without further ado, I shall turn it back to Cassandra to introduce our first expert speaker. Enjoy, my friends.
Thank you so much, Filomena, for your impassioned welcome. And Eric, I just want to thank you as well for being here with us. We've had the opportunity to connect quite a bit over the last couple of years, but I always appreciate your vulnerability and your advocacy and your drive to make the cancer care landscape better for those that come after you. So thank you so much, Eric, for being with us today.